Welcome to this presentation on the SASsix, a set of 6 core asks designed to address the challenges that SAS doctors face across the NHS. The SAS role has long been undervalued and overlooked, leading to issues such as lack of career progression, limited access to development, and poor retention of really valuable doctors. Implementing the SASsix would transform the way that SAS doctors are supported, allowing them to contribute fully to the NHS while enjoying fulfilling and sustainable careers. We are releasing this video now as part of SAS Week 2024 to raise awareness and drive momentum for the SASsix campaign. This is the perfect opportunity to engage with your SAS doctors, healthcare leaders and NHS trusts, and to push for meaningful change that will have a lasting impact on the careers and well-being of SAS doctors.
SAS and locally employed doctors make up nearly a quarter of the UK medical workforce, yet they often face limited career development opportunities, lack of early career supervision and insecure contracts. This has resulted in a workforce that understandably feels undervalued and less engaged. The SASsix was developed as a targeted solution to help address these systemic issues, create a fairer working environment and ensure that SAS doctors have access to the same opportunities as their training and consultant colleagues. Before we delve into the details of each ask, it is important that we recognise the work of key organisations who have helped advance the professional lives of SAS doctors to date. NHS employers have supported the professional development of SAS doctors. The BMA has advocated for fairer terms and conditions. The Academy of Medical Royal College's SAS Committee has been instrumental in providing a voice for SAS doctors at the national level. And NHS England has recognised the importance of these efforts in building a sustainable NHS workforce, which has been mirrored in the devolved nations. It's also crucial to emphasise that the SASsix are not new or original asks. They build on long-standing recommendations from these organisations that have either not been implemented or only partially implemented, and reflect what SAS doctors have been advocating for and asking for many years. Our aim with the SASsix is to bring these asks directly from SAS doctors together into a clear and focused framework for action and implementation.
Our first ask is educational supervision for early career SAS doctors. Supervision is a cornerstone of professional development in all doctors, providing guidance, feedback and support. Without it, SAS doctors are left without a clear direction, which can lead to stagnation and frustration. This ask is about levelling the playing field so that every early career SAS doctor has access to the same structured support as their training grade colleagues. Access to professional development is critical for any doctor to grow and still stay engaged with their role. However, many SAS doctors are routinely denied the opportunities for development, struggle to secure leave for courses or exams, or more commonly not invited to participate at all. Without equitable access, they are unable to pursue special interests, attend key educational events, or build on their skills, which ultimately impact their job satisfaction and career progression. This ask calls for equity of access, ensuring the SAS doctors can develop their skills and ultimately enhance the quality of patient care they deliver.
The next ask is about recognising the expertise of senior SAS doctors by giving them opportunities to become educators. Many SAS doctors already provide informal mentoring and teaching, but they are not recognised as educational supervisors or clinical educators. Being an educator is a highly rewarding role that allows senior doctors to pass on their skills and knowledge to the next generation of clinicians, while also being formally acknowledged for their contribution. This ask would formalize these roles, allowing senior SAS doctors to shape the future of healthcare education while enhancing their own job satisfaction.
The next ask is about ensuring that senior SAS doctors have the opportunity to take on senior leadership roles. Leadership opportunities are not just about career advancement, they're also about having the opportunity to be involved in shaping healthcare and making a tangible impact. Yet SAS doctors are often excluded from these roles, leaving them feeling sidelined and undervalued. By opening up leadership positions to SAS doctors, we're giving them a chance to contribute their expertise and influence positive change.
The next ask is about transitioning our locally employed doctors who have been in their roles for more than 2 years to SAS contracts. Many LEDs are highly skilled and experienced but are stuck in temporary or fixed term contracts, leaving them with no job security, limited benefits and poor access to development. Moving these doctors to our SAS contracts will provide stability, fairer terms and conditions and allow them to plan their careers with confidence. The main ask of this helps to support a modern, diverse workforce and retain our highly skilled doctors who contribute significantly to patient care.
Specialist grade was introduced to recognise SAS doctors who have gained significant experience and expertise in their field and have taken on extended non-clinical roles. However, for many specialty doctors, there is no clear pathway to reach this grade. This lack of structure can be disheartening and lead to feelings of stagnation. Our final ask is all specialty doctors who meet the specifications should have the opportunity to become specialists. A clear pathway in each organisation to the specialist grade will provide motivation and create opportunities for career growth.
The SASsix are not standalone asks. They form a cohesive, integrated framework that supports career progression and professional development for SAS doctors at every career stage. For example, if we were to offer locally employed doctors the appropriate SAS contract, we would have more permanent colleagues to develop within our workforce. Some of these doctors may be early in their careers, and offering those doctors professional development and educational supervision would give us the specialists and leaders of the future. Supporting more experienced SAS doctors to become educators would bridge the gap in our current capacity to train between where we are now and what we might need in the future. These things all feed into one another, creating that most wonderful thing, a virtuous circle.
Implementing the SASsix will create a more engaged, satisfied and stable SAS workforce. SAS doctors will feel valued and supported, leading to reduced burnout and high retention. Most importantly, patients will benefit from a more experienced and motivated workforce that is empowered to deliver the best possible care. These changes will not only improve the working lives of SAS doctors, but also contribute to a more resilient and effective NHS.
The time for change is now. Speak to your trusts, engage with leadership and advocate for the implementation of SASsix. Together, we can create a better environment for SAS doctors and build a stronger NHS. Please share this message, join the movement and let's make SASsix a reality.